Okay. Good evening, everyone. This is James Mack, and we have a quorum, so we're going to call our meeting to order. I will do our invocation, and then we will make motions. Heavenly Father, we just thank you for your blessings today. We ask that you continue to guide us as we go through our meeting. Give us wisdom and knowledge and understanding as far as the things that we do to benefit our county. In your name we pray, amen. Okay, may I get a motion to adopt the agenda for our meeting?
This is Steve, so moved.
Thank you very much. Steve, may I get a second?
Second.
Okay, thank you very much, Mark. All in favor? I will go down my list. Chris, excuse me, I'm sorry. Chris Bowe.
Aye.
Dr. Buckwell.
Aye.
Dr. Hagler.
Aye.
Dr. Bonds. I know she's there.
She's on mute.
Dr. Bonds.
You might be muted, Dr. Bonds.
Steve Morris.
Aye.
And Mark Spitzer.
Aye.
James Magg, aye. Dr. Pons, are you there?
She's still muted.
Is Dr. Daly up there? I can't see. She's not there.
I don't see her yet.
Okay. All right, we do have enough to clear the motion, so all right, thank you very much. All right, may I also get a motion to approve the minutes from February the 9th meeting?
So moved.
Okay, thank you very much, Chris. May I get a second?
Second.
All right, thank you very much, Mark. All in favor? I'll go down my list again. Chris Bowe.
Aye.
Dr. Buckwell.
Aye.
Dr. Hagler.
Aye.
Steve Morris.
Aye.
Mark Spitzer.
Aye.
And myself, aye. James Mack. Dr. Pons, are you available? She's still muted.
She's still showing as muted.
She was a second ago. She popped up.
Okay, I'm sure she will come on.
It's showing her leaving, so she must be having some technical difficulty.
Yeah.
Okay. We will go it on. We do have enough to carry the motion. We will go it on and start our reports. And Sue Yates, you are up.
Hey, good evening, board members. I have our 3 financial reports that I share at the board meetings. The first is the financial summary report. We take what we know to date and go ahead and project, if things continue along this line, how we will end up at the end of the year. We also have our summary report, which looks at our different departments. Everyone is in the green area except for dental, and there is a budget revision, and the revisions to bring them more in line with what they're expected to do this year. And then we have our variance analysis year to date, which is more based on where we were last year to where we are this year in actuals. So if we have a grant, that the dollars are given to us before we've done all the expenditures, or if we have all the expenditures and we're waiting on reimbursement, those type changes are not in here. It's just actual cash to date. Does the board have any questions about these reports this month?
Okay. If not, then we will basically move to our next agenda item, which would be the COVID-19 update. Did Dr. Pons come in?
No, she's not.
He's switching computers.
Okay.
All right. Good evening, everyone. Sue, I am going to bump you so I can share my screen and my slides, okay?
Yes, ma'am.
All right. Give me just a moment, folks. All right. All right. Can everyone see that slide, the title slide that is on the screen now?
Yes.
Okay, excellent. All right, good evening, board members. I'm going to provide you with a very concise update for COVID-19 this evening. If you have any questions, please feel free to stop me, but I am going to move quickly. So this is our COVID response to date total for Cabarrus County. So we're at 18,810 total cases. But what I want to draw your attention to here is the decreasing number of daily new cases. So you can see if we were to draw a trend line, the trend line would be moving in the right direction, which is exactly what we want to see here. So the teal color are PCR molecular cases. Those are labs that have to be sent off to a lab, and red takes anywhere from 12 to 24 hours. The antigen are those rapid tests that are becoming more and more available. So this is moving in the right direction overall. This was accessed just earlier this afternoon. Our percent positive continues to trend in the right direction as well. So we like seeing that number back in the fives. We'd like to see that below 5, quite honestly, but our most recent percent positive was 5.6%. So this is also trending in the right direction and as low as we've been since, you can see, back in the October time period. This slide may be new to some of you. The state also captures percent positive on a rolling basis. So we get a report every Wednesday. That was the previous slide. This is the rolling percent positive. And so if you look at this at any point in time in the day, it may be different, but you can see here when our epidemiologist Meji accessed this earlier today, we're actually sitting at 5.2%. So we like to take a look at this multiple times throughout the week just to make sure that we're not anticipating any surges. Our hospitalizations in Cabarrus County continue to trend downward, which is just excellent news. We are so glad to see this as well. And so we hope that our hospital partners are feeling a bit of a reprieve from this. They've done an excellent job. I cannot say enough how much we appreciate them. And so we are thankful to see this also trending in the right direction. Want to talk for a few minutes about vaccine clinics. It feels like we've been doing vaccines now for about 1.5 years, but quite frankly, it's only been since the end of December. And so we're keeping this comprehensive list. So at some point we can reflect back and see all of the clinics that we had. So you'll see what's grayed out, or those are historical, what we've done already. This week we will have additional clinics. So on Thursday, our partnership with El Puente is going phenomenally, and they are actually going to strive to do 180 vaccines, first dose vaccines at El Puente. On Thursday, we also have a partnership with Purdue, the manufacturing plant in town, and StarMed, which is a testing and a vaccination partner. So we will be transferring about 170 doses to them, and they'll be vaccinating our community members who work at Purdue. So that's a great partnership. On Friday, we'll be back at the arena for first doses, and on Saturday, back at the arena for second doses. The DHHS dashboard is updated frequently as well, so you can look at this at any point in time and see how we're doing, not only in Cabarrus County, but our neighboring counties. So here you'll see just shy of 25,000 first doses administered, and then the percent of first doses of the total population at 11.25, which is absolutely great. We are also tracking this internally. So on the left, you'll see what CHA has done, but then on the right, more importantly, what all of our community partners who are vaccinating community members have done. So we're just shy of 40,000 total vaccines given. This does include both first dose and second dose. If you'll look there, the first dose, 24,358. When we look at our percentage, we look at the population that's actually eligible to receive the vaccine, and those who are 0 to 15 years old are actually not eligible at this point in time, so we take them out of the denominator. So just as a reminder, our goal is to vaccinate 80% of our community, and we appreciate all of our partners who are helping us to get that done. We're keeping a close eye on our demographic data as well, wanting to make sure that all of our populations have access to the vaccine. And so this is from DHHS's website, but we are continuing to see all of these move in the right direction, but definitely still work to be done as well. So I want to tell you a little bit about how we're getting that done, and just talk about, finding heartwarming stories during this pandemic. So our community paramedic partners have done a great job in doing a homebound visits to provide vaccines. So on the left, you can see they're actually at the arena getting all of their supplies. And then on the right, that's Ann Coffey. She's doing a home visit. These pictures were taken from a story that Channel 9 did. So if you haven't seen that, you can look at Channel 9's website. But a great story they ran just in the last couple of days about the homebound community paramedic program. Our transportation partners have been amazing in bringing individuals to various clinics. And so we appreciate them. El Puente is hosting us every single Thursday at that site and done a great job. They started with a soft launch just a few weeks ago with 30 appointments, and it seems like every single week they double the numbers that we're serving there. And then Meals on Wheels continues to survey their program participants as well, and then we link them either with a transportation partner or the community paramedics to ensure that they are being served. Luckily, we're so excited to see that new vaccine providers are being onboarded by the state. While we enjoy doing vaccine clinics, we don't want to be the only game in town, and we want to share in the vaccine clinic love. And so you can see here the full list of individuals, organizations who are providing vaccines now. So the two at the bottom were most recently added, and we'll begin to get vaccine directly to them soon. So this list will continue to grow, which is a good thing. So as many of you know, we are in Group 3 now. The governor accelerated moving into Group 3 sooner, both with the first bit of Group 3 and then the second. So we are vaccinating Group 3. A couple of things with Group 3, these individuals must be working in person and then must be in one of the 8 sectors. There's 7 sectors listed there, and education and childcare is the 8th. And so, again, with so many people working virtually, the big defining factor here is must be in person, but we've seen a great uptake of individuals from Group 3 want the vaccine, which is exactly what we want to see. The county alert system updated recently, and we're excited to show that Cabarrus County has moved from red to orange to yellow pretty quickly. And so on the right, you can see what those metrics are and how you are either red or orange. And then on the bottom, you can see what our metrics were when they determined this most recent report. So while we're excited to be in yellow, it's also a good reminder that we want to stay in yellow. So we have to continue to work hard so that we don't slip, because it is indeed a slippery slope. And then just as a reminder, Dr. Coyle and I, about the same time the state constructed their metrics, we did the same. And so this is just a reminder of our color codes. Many do aligned with the state's. And so we too are in the yellow zone because of the percent positive in the hospitalization metric. So last I checked at the DHHS website, we're at 308 per 100,000 residents in the last 14 days. So that metric, if we were to look at that singularly, would keep us in that orange category. But I am hopeful that we will see that continue to decrease as well. And just some feel good to end this presentation. We continue to be absolutely blessed and thankful for the amount of community support we've been getting. So on the left is Cabarrus County's Ch3 Committee, or members from the committee who served lunch to volunteers and staff who worked at the arena one day last week. And so we're so thankful for their time and their positivity and being at a clinic. So it was very heartwarming. And then on the right, that is actually school nurse Patricia Bettis, who is the school nurse at A.L. Brown, and that is her brother. She's vaccinating in the car. So she was excited to be able to vaccinate him. That was not staged. He happened to get in the right lane and the right table. So that was just good fate right there. So that is all I have this evening, and I'll be happy to answer questions if you have any.
Okay, any questions?
No questions here, but Aaron, as I have said in our Monday morning calls, continue to hear nothing but favorable comments from folks that that have been through the clinics. They are so appreciative of the efficiency and the organization. And also I've heard quite a few people say everybody is so nice and courteous. And so we really appreciate what you guys have been doing. and certainly realize the number of hours and the work that's gone into it. So thank you very much.
Okay. All right, again, and we definitely want to thank the guys for the job that they're doing with the vaccines, because it is working very smoothly. I've been over there myself a couple of times, so it is going very well and very efficient. Okay, we will now have our health director's report, and Dr. Core will take care of that for us.
Good evening, everyone. The health director's report for this evening is in your board packet. I hope you all had a chance to take a look at it. I'm going to highlight just a couple of things so that we can continue on through the rest of the agenda. And I'll highlight those things which really align well with our key focus areas this year of equity, data, leadership, and public health 3.0 support. So in human resources, we are in our final round of interviewing for our equity coordinator position, which will really be key as we move towards promoting both internal and external equity. Finance, our grants folks have been extremely busy. Submitted over 6 grants for over $1 million in February, and we have about $1.7 million pending in additional funding. Under our clinical services, I really want to take a minute and highlight and thank our FCC team under Megan Shuping. The state has allowed us to use our family care coordination team members at vaccine clinics for the past few months, and they have been just invaluable in providing additional resources so that we can actively vaccinate our community. So again, thanks to Megan and the team for all their efforts at helping us run very fluid clinics. In our dental program, we submitted a grant to the Office of Rural Health. As you all, I hope, are aware, because of the schools being in Plan B or C most of the year, we have not been able to have our mobile programs out at the schools, and so we're submitting for grants to try to take the mobile units to other areas too, so that we can maximize the efficiency of our dental staff. Our school nurses have been busy working in partnership with the schools, and again, phenomenal partnership there. In February, Cabarrus County Schools returned to Plan A for pre-K through 3rd grade, and so the nurses have been very active in working with them to assure that we mitigate any spread of COVID. They've been working with the schools to deal with the mental health impacts that are arising from students being in a virtual environment so long. They are also doing a phenomenal job with the rapid antigen testing program. We are expanding this week from 2 to 3 sites at Kannapolis and 6 to 16 sites in Cabarrus County Schools of being able to offer rapid testing to any child and family members where the child is found to start developing symptoms at the school. So this is a wonderful strategy for mitigating the spread. And the school nursing director is starting to talk with the school districts about the plan for use of school nurses through the summer months, as both school districts are planning on some summer school type programs. As a reminder, April 5th to 11th is National Public Health Week, and we will be celebrating here at the Alliance, and the Cabarrus Public Health Interest is planning a fundraising campaign for that week to raise some dollars to continue to support our programs. Our Healthy Living programs, our Minority Diabetes Prevention Program has developed a campaign, a marketing campaign, because we're looking to recruit additional members to join our program. So we're hoping that will promote additional interest to help folks prevent the development of diabetes. In our environmental health program, I've talked with you before that we've been somewhat short-staffed. We did hire 1 food and lodging personnel this past month, and we have looks like we'll be making a second offer shortly. So we're excited to get that program back up to full staffed. Under our Healthy Cabarrus work, we are submitting for year 5 of our Drug-Free Communities grant and plan to apply for additional refunding for years 6 through 10 in the near future. And the work of the Healthy Cabarrus is back up and running with committees meeting to address the 3 priority areas that we have identified. Under our quality improvement and data, we have been selected by NACCHO to lead a performance improvement effort with Region 4 counties. So we're excited about that. And we've started some data training, a data training series with our own staff to help all of our staff get more comfortable with data, again, as that is one of our priority issues for this year, to get scorecards and report cards up and running and move towards programs as much as possible. And we will be up for accreditation in the North, as part of the North Carolina accreditation process, and we're looking at November of this year for that reaccreditation process. For Board of Health activities, I again want to thank the board members who have been volunteering at our COVID vaccine clinics. Dr. Pons and Mr. Spitzer and Mr. Mack and Dr. Daler have all volunteered, and thank you for your time. It's really a morale booster for our staff when they see the Board of Health members out there volunteering right alongside of them. For some national, state, and local updates, I have requested a meeting with Representative Wayne Sasser to discuss and advocate for additional funding for communicable disease, as the COVID pandemic has shown us that we need better infrastructure in order to handle these types of pandemics. Just a few things that aren't on the update, which have just come out in the past few days after I submitted the report, is we've learned from the state that there is, unfortunately, yet another Ebola outbreak in Africa, in Guinea and the Congo. And so they are starting to restrict travel to only a few airports in the US from those areas to try to assure that this does not become a problem again here in the US like we experienced a few years ago. And they're asking all of us to be on alert and potentially prepared to start revamping some of our previous planning for what we will do in the event that we have any cases that evolve here in the US. And then some other state legislation that pertains to public health. House Bill 196 was passed, which it extends medical assistance funding for another few months due to COVID, and that's very helpful for us here in the agency because of the revenue that we do get from medical assistance. So that helps us in our dental and our medical clinics. Some of you may be familiar that a Senate Bill 37, which was put out to mandate the opening of all schools. Governor Cooper vetoed that, and then a veto override of that failed, so that there is not a statewide mandate for schools reopening, but it's being left at the local level. So that was sort of interesting. House Bill 209 was introduced by Representative Baker, who represents our own area, to promote statewide telepsychiatry services throughout the state. And I think that the COVID pandemic has shown that that is very effective. And with mental health being one of our priority areas, it's great to see the ability to continue those services if that bill gets passed. And then lastly, there's also been a bill submitted to look at grant funding for vaccine hesitancy, as we are noticing that we have populations that are hesitant, and so the state wants to be sure that we have efforts out there to educate and encourage all folks to be vaccinated so we can return to normal functioning levels here in our county. So that is my report. Does anybody have any questions about some of the things I highlighted?
Bonnie, I had one question. I apologize if I might have missed it, but I had some communication from Representative Baker last week, and she mentioned House Bill 196.
Yes.
that had you, does that bring more funding to us?
It's, the main thing that will bring additional funding to us for is that one of the stipulations of House Bill 196 is that the medical assistance reimbursement was bumped by 5%, and that was going to stop in March. House Bill 196 extended that through May, so we get at least an additional 5% additional reimbursement for our Medicaid claims. So that's some money. The other thing it did was give $3 million to the Department of Health and Human Services to improve the CVMS system. The CVMS system is the vaccine tracking system that the state uses, and we've mentioned to you before that there's been some issues with it and being able to get data in a timely fashion and then to run reports. So they provided additional funding to improve that system. And then 15 million went to the UNC Policy Collaborative around surveillance around COVID to look for trends in that. So what brings money to our county specifically in that bill is that bump in MA reimbursement.
Okay, great, thank you.
Sure.
Any other questions? Okay, if not, we will move to our consent agenda items, and that would be Sue Yates up again, please. Budget revision.
Yes, this month, board members, we have 16 budget revisions. The largest one is getting the actuals in line, the budget in line with actuals for the dental clinic. While they were down a provider, not able to get into schools, we continue to assess that program and ensure that the budget is in line. Are there any other questions from the board regarding the budget revisions?
Okay. Hearing no questions, can I get a motion to accept the budget revision?
So moved.
Okay, Mark, may I get a second, please?
Second.
Okay, that was
Dr.
Dr. Taylor. Thank you very much. All right, all in favor, I'll go down my list. Chris Bowe?
Aye.
Dr. Buckwell?
Aye.
Dr. Taylor?
Aye.
Dr. Hagler?
Aye.
Dr. Pons?
Aye.
Thank you. Steve Morris? Mark Spitzer?
Aye.
And myself. Thank you very much. Our next item will be our business agenda, which will be the Finance and Grant Development Strategic Plan for 2020 through 2025, and that will be Kristen Boatwright.
Good evening, everyone. Thank you for the introduction. My name is Kristen Boatwright. I am the Assistant Finance Director, and I will be presenting the strategic plan for finance and grants development, if we ever get there. Okay, if you can go to that second, yeah. So looking at how we can use data to improve health from a grant writing and development perspective, we have established one or two objectives in each of the various goals for this particular priority. Next slide, please. So first, so that we can adequately track and measure progress, we are currently working with Betty and Clear Impact on getting our scorecard created and finalized. So the performance measures we will be reporting on include customer service, budget performance, accounts receivable, as well as grants. We are currently working with Clear Impact developers on the best way to depict our data so that it tells a story, a helpful story. So additionally, In an effort to increase transparency to CHA employees, the community, existing and potential partners, we will be sharing information on our website about the grants that we go after, which needs assessment priority they address, and if we were indeed awarded that grant and at what capacity or not. So we feel that this will ensure informed decisions are made, and like I said, transparency for development and grant projects is apparent. So this can also be used as a resource for the public to know which grants that we have. Next slide. All right. Continuing with grants under this priority, we want to make sure that we are using data that is current, relevant, and analyzes data using an equity lens. So we're creating a repository that can be used as a resource for staff when working on grant development narratives. So this will also tie into our priority 2, goal 3 that we will discuss later, but we feel like this will ensure that we as an agency are using consistent and appropriate sources for our data. And looking at the financials, we want to ensure program, budget, and department managers are using and analyzing financial data that is provided to them both on a quarterly and a monthly basis. And from that data, be able to assess any internal needs that perhaps are not being fully met. So we feel that this will ensure programmatic gaps are filled. We can be proactive in addressing any downturns. Staff will feel more empowered, and thus performance will be improved. So we currently have one-on-one biannual meetings that specifically focus on looking at the numbers and assisting with forecasting, spend down, and identifying any barriers in program implementation. So those will continue, and we'll be doing some additional work around that. And next slide. For the second strategic priority, we have objectives that focus exclusively on grants for both goals 2 and 3. And with so many of our staff being grant funded at some point or in some capacity, it's essential that we have a policy in place that ensures hiring staff is both inclusive and equitable for those who are marginalized and underrepresented. So this requires using an equity lens when hiring these folks. Thus, we, Sarah, our grant writer, created a policy that outlines and streamlines how program and support staff are hired for grants. And so we feel like this will ensure grant staffing is an even and fair playing field. Next slide. Of course, we go after grants because there is some unmet need, often for a specific population. So with this objective, we will actually be measuring the grant applications that are submitted that integrate an equity lens into community-based work. This is something we are currently doing, but we're now making a more concerted effort to ensure applications are equitable using CHA's definition of lens for definition of an equity lens. So are there any questions about our objectives for priority 1 or 2 so far? All right, next slide then. So we felt the chosen goal for CHA's third strategic priority didn't really align with finance or grant development at this time, thus we didn't have any objectives in that area. However, our objectives in the final strategic priority area is one that I am excited about. So if you want to go to the next slide. What we want to do is make sure that staff are capable and comfortable when it comes to grant management, compliance, and CHA finance policies and procedures. Therefore, we will be instituting a grants management award kickoff program. So in this program, we will be meeting with grant staff and discussing everything from their agreement addendas or award terms and conditions, allowable and unallowable expenses, using and tracking indirects and any reporting requirements, the process for purchasing and contracting and accounts payable, etc. So we feel like this will not only improve staff capacity, but will also positively impact award compliance. So we're really excited about getting that up and running in the near future. Are there any questions? Okay. Well, thank you for your time.
Christian, thank you very much. And the next agenda item that we have would be our 401k discussion, and that would be you, Dr.
Yeah. So last year, the board had voted to approve an increase in the 401k match from 1% to 2%. It was included in the budget that was approved. Because of all the uncertainties during COVID this year and our concerns about revenue losses and the adjustments that you've seen us continue to make on the budget per Sue's reports, we held off on putting that into effect. It felt like because of some of the furloughs and that we had, that didn't seem like the right time to then increase a 401k match. Since the board had said that was to go into effect this year, and we are coming up on the end of the year, I wanted to come back to the board with a recommendation to hold on doing that until the end of the fiscal year to see how we do, since we're still struggling with making sure we make budget and not lose money, and then potentially agree to do it starting in July if our funds do look like we're going to break even or be okay. So, because the board did have that as something to put into effect, I wanted to bring it back for everybody to hear that recommendation and see if that is what we definitely want to do.
Discussion?
Mr. Chairman, first of all, I would suggest that it's admirable that we want to maintain our budget and stay within the boundaries. So nice job on that. What I'm reflecting on is it's hard to look back on 2020 and that we have had thus far and realize the work that the team has done and not want to extend them the grace that this would allow. And then just realize the missed opportunity of timing of that opportunity to collect 401 monies as a match. It's opportunity lost, and I understand the budgetary needs, but I certainly would support us trying to find a way to extend this.
I would agree with Chris. I think if we're going to keep good people in public health, one of the things that we're going to have to do is figure out a way to make that financially sustainable for that individual as we can. So I would support initiating that 2% match.
Okay.
What percentage of the employees take advantage of the 401k?
Sue, can you join in and share that?
Yes, the last time we ran the numbers, which was just a couple of weeks ago, there were 139 of our employees, and we normally sit around 215-ish full-time employees. So a little bit more than half do that contribution currently.
At 1% or less?
No, 32 do 1%, 107 do more than 1% for their match. So it would automatically benefit 107. 32 would likely move it from 1% to 2%. And it's kind of hard to say, depending on where people are in their retirement planning, if additional folks would join in.
I'm in agreement. This is Kim Taylor. I'm in agreement for reevaluating it as well as we get closer to the end of the fiscal year.
Okay, all right.
And
So, do we need to put a motion forward to vote on?
You have, the board approved it in the budget of last year. It's one of the things we held off on. So I don't know that it's a motion so much as just simply saying either carry forward, implement right now, or, well, I guess it would require a motion, either carry forward and implement right now, or reevaluate as, you know, this last quarter and then implement in July.
Okay.
Dr. Cole, as a board, did we take it off the table or did that become an internal administrative decision?
We just kept delaying it because of the financial problems that we were facing and with furloughs. We had, at one point, if you will recall, this past year, we've had quite a number of furloughs in that. And so it, we sort of kept holding on. We, you know, the decision was to implement it at some point this year. I think January, Sue?
Yes, we had originally talked about doing it in January. And then January, the vaccine distribution came out. And we have been busy with that and looking at that. So it is certainly something that we can put the procedures in place and make that change. I did include it as I'm working with the departments on their budget for next year as well. So the direction of the board will determine how we move forward.
Right. So I am by no means a Robert's Rules of Order person. So somebody else has to intervene there. But if the board did not take that off the table, then I don't think it needs any action to put it back on the table by the board, in my opinion.
Okay. So the recommendation is that we continue to look at that through the end of the year then.
Since it's in the budget, it seems to me that we would implement that.
I'm sorry, go ahead.
Go on, Chip. I'm sorry to hear you.
No, it's okay. I was just saying, if the board didn't rescind that, I think at any point in time, the administration can reinstitute that because it's part of the previous budget.
Okay.
Now, I'm grateful that we talked about it, but I don't think it's the board. In my opinion, I don't think it's a board action. I could be dead wrong.
We agreed to it, so again, we'll move forward with what we agreed to.
Okay.
Okay.
All right, thank you.
All right.
I had one question. So when this is implemented, it will begin at that point, or is this something that we're talking about being retroactive to the beginning of the fiscal year? You're talking about just implement. Okay. I'm comfortable with management making that decision based on our budgetary requirements at that time. Okay. Fully understanding is something that we approve doing and we want to do it. But we've had some pretty extenuating circumstances. So I appreciate your bringing that to discussion.
Okay. Any further discussion on the 401k? Okay.
If I can, I think it also, in my mind at least, raises the question of how the board might be able to join management in appreciating and thanking the entire staff. I think the 401k is part of the compensation program. I think whether that's in or out is a financial matter that we have accommodated with the craziness that we've lived through. But I do think that we should not wait too much longer to think about what it is we can do as a board and as a management team to substantially appreciate the work that has been done. Everyone here is, I think without exception, has really put in an enormous effort to make to help us get through this pandemic. I don't know what that means. I don't know what the form of recognition and/or reward is, or might be, but I do think that we need to think about it and be prepared to do something reasonably soon. And I would be interested to know as well whether, Chris, whether your folks are doing anything along those lines. Chip, whether, you may not have as much flexibility. Chip, Steve, I don't know if Mike and company are thinking about anything that would, but I do think that we should look at this.
So as to Atrium Health, I would say that it's been remarkable how we've held our teammates in good stead throughout the entirety of the pandemic and have not had to, or we really did not furlough. We needed to furlough teammates, but we did not furlough teammates early on. And so we've kept our teammates whole throughout this. And that would include merit increases that we plan to move forward. And so there's opportunity there. So I think that really is notwithstanding the pressure that the CHA independently feels and understanding the financial situation of the CHA. I think we really need to pay attention to our budget and be good stewards of the budget while also trying to manage the resources to support our teammates. I'm glad the board had moved on this, earlier and put it into this year's budget. I probably would rather have had a conversation early on about what mitigating factors we could have taken into account inside the budget other than this. But that, that's a little bit of a horse out of the barn type thing.
Any other comments? Okay. If not, the next agenda item would be public comments, which again, generally we don't have the public involved at this point in time. So the next agenda item would be announcements. And the only announcement I have at this point in time would be that our April meeting would be on April the 13th. And I did want to propose to the board, or at least put it before the board. I think most of us have been vaccinated, and is there a possibility, or how many would be comfortable with us coming back into regular sessions in the month of April? So I'd like to kind of open that up for discussion.
Mr. Chairman, I would be in favor of that. As far as our county commission goes, our tentative plan is to go back to in-person meeting at our work session, which will be April the 5th, I believe, or 6th, depending upon, that might be Easter, but we're going to provide for proper social distancing and begin our meetings back in person, unless somebody from the Public Health Authority would advise us to do otherwise.
Okay. Are there any board members? Again, we are looking at using a larger room. Yeah. So again, we will be meeting downstairs, which will be a much larger space that would give us the availability to make sure that we're within COVID protocols. So I want to make everybody aware of that. But again, as far as going back to in-person meetings, if everybody's in agreement with that, we will look at doing that in April, and that would be April the 13th. Any objections? If there are any objections, just send us a message and let us know, so that way we can decide how to move forward. Yeah, we can decide how to move forward with that. Okay. With that being the only announcement, unless Bonnie, you had anything you wanted to, okay. No. If not, Dr. Pons, may I get a motion to enter into closed session?
I move that we move into closed session.
Okay. All right. And may I get a second?
Second.
Okay. All in favor, and I'll go down my list. Chris Bowe. Dr. Buckwell.
Aye.
Dr.
Aye.
Taylor,
Aye.
Dr. Hagler,
Aye.
Dr. Pons,
Aye.
Chris Morris, excuse me, Steve Morris, I'm gonna give everybody different names. Steve Morris,
Aye.
and Mark Spitzer,
Aye.
and myself. All right, thank you very much. Aye. At this point in time, we're gonna go into closed session. We're gonna ask, Diane Berry if she would also come into the room.
Mr. Mack, since we're voting on extending terms, do you want me to run the vote now?
Yes, ma'am.
Okay. So it's the recommendation of the nominating committee and also from closed session of the board that we extend Mr. Mack's term to a fourth term because of the bylaws. We're only supposed to serve 3 terms, but with Mr. Mack, he's proven to be an exceptional leader in exceptional times. He has experience with this board that we need at this time. He has he knows the history of the board and the history of our recent past and the improvements and the things we're doing in the board. And he's shown exceptional leadership of the board during COVID. He represents an underrepresented community on our board. And for these reasons, we're asking for him to be extended to a fourth full term. Is there a motion?
So moved.
Can I have a second for that?
Second.
I'll read it. Thank you, Dr. Daler. I'll read down the list. This is to extend Mr. Mack to a fourth term and a fourth full term on the board. All in favor, Mr. Bowe,
Aye.
Dr. Buckwell,
Aye.
Dr. Daler,
Aye.
Dr. Hagler,
Aye.
Mr. Morris,
Aye.
Mr. Spitzer,
Aye.
and myself is yes, and Mr. Mack.
I choose not to vote on myself.
Thank you. So that was passed unanimously. And then by recommendation of the board, we want to recommend that Mr. Mark Spitzer serve a second full term on the board. Can I have a nomination?
So moved.
Second.
Second, thank you. And I'll go down the list one more time. Mr. Bowe,
Aye.
Dr. Buckwell,
Aye.
Dr. Daler,
Aye.
Dr. Hagler,
Aye.
Mr. Morris, Mr. Mack,
Aye.
myself is yes, and Mr. Spitzer.
I recuse myself.
Thank you very much. Then I would like to, is there any further business?
Madam Vice Chairman, what is the procedure on the other vacant term, the other 2 vacant terms?
The nominating committee, I believe, is going to bring I'm going to defer to Mr. Mack, but I think we're going to bring some candidates to the next session for discussion.
Yes. Yes, Steve, we do have a list of names that came from the county commissioners as well as names that were recommended by the board. So the nominating committee will be reviewing those names, talking with those individuals, and bringing back a recommendation to the board.
Thank you.
I will just say we are, trying to look at each candidate based on their merits and based on their representation of their various communities that represent our county. So can I have a motion to close the meeting?
Before you do, Madam Secretary or Madam Chairman, Chairwoman, Chairperson.
I'll take them all.
Laura.
Yes, thank you. Yes.
Just a quick question, historical question, I think more than anything else. Steve and Mr. Mack, I guess both of you have been around long enough to know this. Do the reappointment of Mr. Mack and myself need to go to the county commission for reapproval, or is that something that is automatic and only our board is required?
I think that would be governed by our bylaws. I know that some appointments are go as a recommendation to the Board of Commissioners, but I'm not real clear on this organization.
The bylaws, I looked at these pretty closely, and there is the requirement for the county commission to approve commissioners on the Board of Health, and there is no exception or carve out for reappointment, or even in the case of Chip's person, it seems that there would be a requirement for all 4 individuals to be approved by the county commission as I read the bylaws here.
I just was reappointed last year, and you have to fill out a form online, and then it goes to the county commission for a vote, and then they send you a letter.
Yeah, and typically, we handle those appointments from a number of different boards based on the recommendations from those boards, and usually included in that verbiage would be with an exception to the length of service provision in the case of Mr. Mack, and that would be part of our motion to approve.
Thank you.
So Mr. Mack, oh wait till the motorcycle goes by. Mr. Mack and I will continue to be nice to you, Steve.
Thank you. I had suggested privately that maybe we double your pay as well.
I'm gonna triple it. Can I get a motion to close?
For the benefit of the public, let me be clear that nobody gets paid, so.
That's right. We are on YouTube.
Has no budgetary impact, yes.
There's no budget there. It's 0 times 3. Can I have a motion to close, to adjourn the meeting?
I move to adjourn, Madam Chairperson.
Can I have a second?
I second.
Okay. All in favor. Here we go. Mr. Bowe.
Aye.
Dr. Buckwell. He's done. Peaced out. Dr. Naylor.
Aye.
Dr. Hagler.
Aye.
Myself, yes. Mr. Morris.
Aye.
Mr. Spitzer.
Aye.
Mr. Mack.
Aye.
Unanimous. Thank you, gentlemen. Have a good night.
Thank you.